Welcome to today's press briefing. We have with us two speakers today. They are the head of Communicable Disease Branch of the Center for Health Protection, Dr. Chang Shok-Kwan, and Chief Manager of the Hospital Authority, Dr. Larry Lee. The two doctors will give us update of situations of CHP as well as DHA. Dr. Chang. Good afternoon. Yesterday, we have local positive cases, a total of 2,791 cases, including 1,164 cases of PCR positive case and 1,687 verified RAT positive cases. We also have 204 imported cases, including 168 PCR positive cases and 36 verified RAT cases. We have altogether 1,240 and 25,431 cases. Well, the total number of death cases states as 9,197 cases. I'll now defer to the hospital authority. So far, we have 893 patients staying in hospitals, of which 144 of them are new cases. And those in isolation facilities, there are 326 of them in isolation facilities, and 19 of them are second-tier isolation facilities, and 287 of them are in North Atlanta, Hong Kong Infection Control Center. There are 120 new cases. Yesterday, there were four cases in a critical condition, one with one dose, one with two doses, one with one dose, and two with no such records. And 5 of them are in serious condition. There are 18 critical conditions and 22 in serious condition cases. 4 of the critical cases are in ICU. Today, we have no new death cases. In relation to the 204 imported cases, 74 of them are picked up at the airport. There are 108 of them that are picked up at the quarantine hotels. There are also 21 cases that have left the quarantine hotel. Most of them have got a high CT value. They are mostly repositive cases. And those coming from overseas countries, there are over 10 cases from UK. There are 56 cases, 20 cases from Singapore, 17 from Thailand. From US and Canada, 15 cases each. And for the rest are from other places. There are less than 10 cases from each of these places. In relation to care homes, there are 4 care homes, including 2 care homes for the elderly and 2 homes for people with disabilities. They have recorded new positive cases. There are 2 care homes for elderly people. TWGHS Lazy Ping Care Home. It's TWGHS Ma Lazy Ping Elderly Home. There is 1 case. 2 people from the same cubicle have to be quarantined. The other one is Fong Kai Nursing Home, 1 staff member and 5 close contacts. These close contacts have to be quarantined. For homes for people with disabilities, Haven of Hope, Choi Lok, Ji Lok Gu, there are 4 residents and 1 staff member that have been tested positive. First is the staff members who is a close contact of another confirmed case. It was picked up during quarantine. However, that person worked. So we suggested that everyone in the home had to be tested. We've identified 4 positive cases. The other 35 residents have to be quarantined. The other staff members so far are tested negative, but they have to do another PCR test. Another one is 香港心理衛生會. There is 1 resident from their care home. And 7 people from the same ward will have to be quarantined. For schools, today is a holiday. There is 1 special school, Qi Yan. There is 1 staff member, a teaching staff member, who is confirmed to be positive. The other people from the same school, there are 13 students, will have to be quarantined. In relation to subvariants, there are 43 new cases of suspected BA2.5 12.1. There are 24 without a known source, and 18 of them are linked to other cases. For suspected BA4 or BA5, there are 16 cases, and 9 of which are linked to other cases. 7 are so far with an unknown source. That's all for my report today. In the previous day, we have 103 patients that have recovered, including 92 patients that have been discharged. In the fifth wave, so far, we have 52,729 patients that have recovered, including 52,439 of them having been discharged. We have 65,109 patients that have recovered, including 64,819 that have been discharged since early 2020. There are 2 patients that have been tested positive upon screening at admission. 2 people from the same cubicle are classified as close contact. We have another 35 staff members that have been tested positive. So far, we have 24,708 of them tested positive, and another 5 of them have returned to work. So far, we have 24,360 staff members that have returned to work. I have an announcement to make for Buddhist Hospital. For the nursing award, there is another 2 patients aged 27 and 55 that have been tested positive. They are in a stable condition. They've been transferred back to Wong Tai Sin Hospital for treatment. So far in that ward, there are 16 patients and 4 staff members that have been tested positive. We've conducted thorough disinfection, and control infection team has been following up on this case. In relation to Tien Ga Bing Nursing Home of Pok Oi Hospital, we have recorded positive cases. There are altogether 60 people involved in the ward. They will be subject to test. Another number of people have been tested positive. 2 confirmed patients have been sent to Tuen Mun Hospital for isolation treatment. So far, there are 2 patients and 4 staff members from the ward that have been tested positive. The control infection team has conducted investigation. All 64 environmental samples are tested negative. In relation to patients of care homes, we have a new discharge arrangement. For public hospitals, starting from today, we will strengthen testing upon discharge from care homes for people with disabilities as well as elderly homes. Before they are discharged, they will be tested by way of a PCR to ensure that they have recovered and they are not contagious before they are allowed to go back to their homes. This new arrangement aims to strengthen testing. We make use of more sensitive PCR tests to ensure that those who will be discharged will not infect others. This is to reduce the risk of transmission within homes. We appeal to you all to stay vigilant. Those who have yet to complete their course of vaccination will have to do so as soon as possible. And those staying at care homes and that have not completed their course, please make arrangements to complete their vaccination course to enhance the protection. If necessary, we will be happy to provide assistance.
The floor is now open to questions. Please put up your hand. A staff will pass you the microphone. Before putting your questions, please identify your media outlet. I'm from Cable TV. First question, some experts suggest that we could try the 3+4 quarantine arrangement, 3 days of hotel quarantine followed by 4 days of home quarantine. What's the CHP's assessment in terms of the risks? For Hong Kong situation, would that measure be appropriate? A question for the Buddhist hospital. More people are infected, 16 in total have been infected. Has the infection source been identified? In the short term, will there be a further outbreak in the hospital? In terms of border control measures, yesterday Professor Low has elaborated on that. I will not comment on it further. Now over to my colleague from the hospital authority. For Buddhist hospital, 16 patients and 4 workers have caught the virus. Preliminary speaking, we believe the infection is under control. We will do thorough disinfection and follow up on the cases. Next lady over there. I'm from Now TV. This morning, an expert argued that we could further shorten the quarantine period and results in come back more quickly, that is within 8 hours. And if people can do daily PCR tests 7 days in a row, then we can relax quarantine measures. What are the authorities' assessment? Can we achieve this? Now that for severe cases and deaths, they're on the low side, and that has been so for a while, are we in a position where we can relax social distancing measures and other restrictions concerning traveling? As for your questions, yesterday Professor Low also elaborated on those points. That we're trying to enhance the capacity, speed, accuracy, convenience, and affordability of PCR tests. There are some indicators where we're engaging third-party testing contractors. Your question, sorry, what was your second question? Yesterday, Professor Low commented on this. We are not in a position to relax social distancing measures yet. Next question, the gentleman at the front.
From the South China Morning Post. For the first question, the CHP has previously said that the cases could rise to perhaps 6,000 cases a day. We'd like to ask, how is the hospital authority prepared in terms of manpower and facilities? And also, we want to ask, at which point will they need to turn some public hospitals into designated COVID-19 facilities to avoid a situation that we've seen in the earlier parts of the fifth wave? I also like to ask if you can tell us a little bit about the situation for the serious cases, the percentage rate for the serious cases, the hospitalized cases, and also the death rate, and what the situation is like now. Are you worried about these sort of indicators right now? Thank you.
I'll leave to our hospital colleague to answer your questions.
All right, okay. The cases number of the serious and also the critical cases is quite stable for the recent case, and there is we didn't observe any sharp increase on that. As for our preparedness, hospital authority, we have formed a emergency operation committee, and once it can be activated by our top management, we can increase our response to decrease our response time to monitor the situations and also to monitor the case number in order to implement some measures to increase our capacity to cater the increased number of the COVID cases. That will be in terms of the manpower. We now have a named deployment plan from the cluster hospital so that we can deploy certain number of manpower, especially the clinical staff, to the community treatment facility to help, namely the Hong Kong ICC and also the potential opening of the AWE and also the Penny Bay CIF. And also we have a plan to be within 48 hours we can mobilize some more than 10% of the hospital bed. That's mean nearly 2,000 beds to cater the increased number of the COVID patients. And also we have a response plan to reopen the AWE and also to increase the ward number in the HKICC to cater. And I think this is the plan from the hospital authority.
Next question, the gentleman over there. A question for Dr. Larry Lee. Sorry, what's your media outlet? I'm from Ming Pao. Just then, Dr. Larry Lee mentioned the discharge criteria. On which day should the PCR test be done? Is a negative test result required, or is a CT value over 35 good enough? Why aren't we sticking to the old practice? Now, we have seen wards where more than 10 people are infected. Has the health authority done any investigation to find out why is this the case? And in terms of hospital admission screening, is the specimen taken on the same day? When is the result available? Second question for Dr. Chuang. For PCR tests, are there guidelines, requirements for the testing contractors? Are there accuracy or timeliness requirements? What happens if they fail to meet the requirements? Just then, with the testing incident with BGI, with Sunrise Diagnostic, do we have any update? Some people didn't get the result and was allowed to go home. So what's the focus now is on testing. For the Department of Health, if something similar happens again, what actions will be taken? Sorry, you have raised more than 15 questions. Dr. Chuang, please. For care homes, I will elaborate on this further. For the elderly and persons with disability, if they have more than two jabs or more, apart from RT test, we want them to take PCR test as well. If they test negative or the CD value is over 35, then they can be discharged. This step is taken to protect the care homes. These are patients who are vulnerable. And for those who have fewer than two jabs, and they will have to be isolated up to day 14. The isolation can take place at the hospital or community isolation center or at the holding center. So this is the arrangement. And for staff members, there are several hospitals where HA staff workers or patients have caught virus. In terms of the environmental samples, they've all tested negative. It has also come to our attention that some HA workers may have had cross-infection during meals, but there were no close contact. Now this is where the HA believes there's a need to step up testing. So testing will be stepped up for workers, especially for some wards where the patients are particularly vulnerable. Now for PCR tests, yesterday Professor Low also mentioned this. We will be asked third-party testing contractors to return a result in no more than 24 hours. Now, as for the case at Hong Kong-Macau Bridge, the testing contractor there, where irregularities were found in the testing results, on the 1st of July, we responded to the relevant media inquiries. The testing contractor has already submitted a preliminary investigation report confirming that at the port where a lab was set up, there was environmental contamination. The contractor has thoroughly disinfected the lab and the equipment. On the 22nd of June, lab operations resumed normal. The implementation of the measures has also started to prevent the recurrence of similar incidents. If there's no other questions, well, we'll take the last question from the lady in blue.
Yes. Could you please recap in English that what is the criteria for the further testing for elderly home staff or residents, and what is the reason behind how the authorities launched new testing now, and is there any manpower supporting these new testing measures? Thank you.
Yeah, we're talking about when the elderly or physical disabled person that have to discharge back to their hostel. For the patients who receive equal or more than two vaccines, on top of the rapid antigen test, we want a PCR test when achieve either a negative or a CT value more or equal to 30, we can let them go back to the hostels. But however, for some cases that receive less than two vaccines, such cases need to be isolated in either hospital, CIF, or holding center up to day 14. We aim to increase the protections to the other cases in the hospital because they are more prone to a severe illness. And I think the CT value more than or equal to 13 has been demonstrated to be safe and also evidence-based and on a valid scientific background.
今日記者會完結，多謝大家。
That's the end of the press briefing. Thank you.